Hi everyone, welcome back to my channel. If you're new here, my name is Kirtana. I'm a final year nursing student at the University of Toronto's Accelerated Nursing Program. This video is going to be all about how to prepare for your nursing clinical placement and what's expected of you as a student on your placement. So regardless of your clinical placement, the expectations will be very similar, but it'll be just specific to that patient population. So the first thing you want to ensure is to show safe, ethical, and competent practice. What I mean by that is don't do something that you're not authorized to do as a nursing student, like giving a high alert medication, giving narcotics. You're not allowed to do that as a nursing student, so don't do it. And also make sure before you do any task or any skill that you're authorized to do, make sure you have the knowledge, skills, and judgment to do that. Otherwise, grab your CI or grab your primary nurse to help you with it, at least the first time. Expectation number 2 is to show critical thinking when you're solving problems and when you're making care decisions about your patients. Your practice must be informed by evidence. It's called evidence-informed practice. Whatever it is you're doing in your practice, it has to be backed up by evidence that it benefits the patient. Expectation number 3 is to focus on the centrality of relationships with your patient. What that means is to make sure to not let your biases get in the way of providing the care that the patient needs, and make sure you focus on the patient and maintain a professional therapeutic relationship with your patient. You cannot have personal relationships with your patients. Expectation number 4 is to promote the health of the patient and capacity building. What this means is that a huge part of nursing is to provide health teaching to the patients to take charge of their own health and teach them how to maintain it by providing them the knowledge that they need and also the skills they need. And when you're providing patient education, make sure you consider the social determinants of health, which are all of these other aspects outside of their lifestyle changes that they can make in order to take care of their health, like housing, address housing issues and connect them with the appropriate resources. Make sure you think about their income and the neighborhood that they live in and all of those other social determinants. And the final expectation is interdisciplinary collaboration, which means if there is any patient needs that are not met, or if you find any concerning information about the patient during your assessment, make sure you communicate that with the appropriate healthcare provider. It could be the occupational therapist, physiotherapist, pharmacist, social worker, or even the doctor, or any other nurse that you're giving report to when your shift is done. So make sure you communicate those changes and collaborate with other members of the healthcare team. This part of the video is going to be about how to prepare for your clinicals. I'm just going to tell you how I prepared for my clinicals first year, but it's really up to you what you want to take away from this part of the video. Tip number 1 is to make sure that your modules are complete and up to date before you start your placement. Next, you want to make sure that you have the information handy on where you're meeting your clinical instructor and your clinical group on the first day. And make sure you get there 15 to 20 minutes early so that it gives you time to explore the place a bit and figure out where you're meeting your group. Tip number 3 is to make sure you get enough rest the day before your clinicals, otherwise it'll impact your performance significantly. Even if you don't fall asleep right away, just get to bed early so that'll give your brain some time to wind down and stop all of those thoughts from running about how your clinical is going to go on your first day. Alright, my next tip to you is to make sure you pack a lunch and some snacks, especially if you're going to be in a long-term care setting. There's going to be very limited food options in the long-term care itself, and you have to walk quite a bit to see any actual food places. It'll save you a lot of time and energy if you just have something ready that you can quickly eat if you're feeling lightheaded or if you're just not feeling well. And trust me, you will be hungry and tired after standing for 6 to 8 hours a day. And in addition to that, make sure you eat breakfast before you leave, because you actually don't know when you'll even get a chance to eat, especially if there's something interesting happening on the unit. You might just want to stay and watch, and if you're hungry, you will not be able to do that. Right, my last tip to you is to make sure you pack your clinical bag the night before. I'll make a separate video showing you what I pack in my clinical bag usually, just to give you an idea. And also print out all of your worksheets and everything that you need the night before, ready to go in the morning, because you will not have time to pack your bag in the morning. You just won't have the energy for all that, especially if you have to wake up so early. If you're not used to waking up so early and you have to wake up so early just to get to the placement. You might feel overwhelmed or nervous to start your clinicals, but I promise you it'll be fun. Just take initiative and, be curious and willing to learn as much as possible, and have a positive attitude when you go to your clinicals. That's all that matters. And that's all I have for this video. Thank you guys so much for watching. I would really appreciate it if you could like my video and subscribe. Make sure to comment if you have any future suggestions that you want videos specifically about. And my socials are down in the description below if you do want to follow or just message to ask any questions about the program in general or my experience of it. Thank you. Bye till next time.